So the word from the Stockholm region pretty much gives you an idea of where things stand. They fear that they've lost control of the spread of the virus. In some areas of Sweden, we're even seeing a tripling of the number of new cases from one week to the next. We've reached 6,000 deaths now. People are still getting admitted to hospital at an alarming rate now, and the government is really concerned about what is happening in the country. 10 different regions in Sweden have now imposed local new recommendations where they're asking people to not make physical contact with people that they don't know or people that they don't actually live with. They want people to avoid going to the store, avoid going to the gym, avoid public transport, for example, all in an effort to try to stop the spread of the virus. Now, there are some people, though, that are really concerned that the government is just not doing enough by not imposing any kind of mandatory lockdown. There's a group of researchers and scientists called the Science Forum COVID-19, and I spoke to one doctor in this group, Anders Jansson. He told me he's really concerned that the government should do much more, otherwise within the next couple of weeks hospitals might be overwhelmed.
Our hospital is currently in an alert state because of the huge numbers of COVID patients. And what we see this time around is that in the spring we were kind of saved by the fact, the healthcare system was saved by the fact that patients with other diseases such as heart problems or stroke or so didn't dare to show up in the healthcare system because they were afraid of getting COVID. So they didn't come in as, the numbers were smaller with those people. That's not the case now. We have the normal amount of all other diseases, and on top of that we have a hugely increasing COVID problem. I think mandatory face masking is very good, and we need to step up testing, tracing, and do good isolation. And the other thing is we should, in my opinion, close down all those activities that are not necessary where people socialize. That is restaurants and pubs and gyms and shops that are not necessary for people to survive the next few weeks.
That's Anders Jansson from the Science Forum COVID-19, and they want the government to put mandatory restrictions in place, such as the usage of face masks or even closing down stores. But the government is still saying they don't want mandatory requirements on people. They don't want a mandatory lockdown. They want people to make up their own minds of how they can avoid trying to make new physical contact. I even spoke to Anders Tegnell, Sweden's state epidemiologist, just last week, and I asked him this specifically, and he said, no, we're not going to put any kind of mandatory lockdown in place, because here in Sweden what works are these recommendations, and then it's up to people to make up their own minds how they are going to work to try to limit the spread of the virus.